Ozempic is a once-weekly injectable medication formulated to help adults with type 2 diabetes manage their blood sugar. Although not officially a weight loss drug, research suggests that people who take Ozempic may lose modest amounts of weight while on the medication. What is Ozempic? Ozempic is an FDA-approved prescription medication for the treatment of type 2 diabetes in adults. It helps improve blood sugar in adults with type 2 diabetes and is proven to lower hemoglobin A1c, a measure of blood glucose over time, according to research cited on Ozempic's site. It also helps adults with type 2 diabetes and known heart disease lower their risk for cardiovascular events like stroke or heart attack. The active compound in Ozempic, semaglutide, is a glucagon-like peptide 1, GLP-1, receptor agonist. It works by activating GLP-1 receptors throughout the body and enhancing the effects of the naturally occurring hormone GLP-1. GLP-1 serves multiple key functions in the body, explains Christopher McGowan, MD, a gastroenterologist specializing in obesity medicine and endobariatrics, and founder of True You Weight Loss in North Carolina. It boosts the release of insulin by the pancreas in response to food intake, which helps to control blood sugar. Likewise, it reduces the release of glucagon, a hormone that increases blood glucose, thereby also helping to control blood sugar. Ozempic is a once-weekly self-administered injection of semaglutide. It comes in 0.5 mg, 1 mg or 2 mg dosages. Is Ozempic insulin? Ozempic is not insulin. It helps your pancreas produce more insulin when your blood sugar is high. Unlike insulin, Ozempic rarely causes low blood sugar, notes California-based Lydia Alexander, M.D., a board-certified obesity medicine specialist and president-elect of the Obesity Medicine Association, the largest organization of clinicians dedicated to preventing, treating, and reversing the disease of obesity. Ozempic for weight loss, how does it work? While Ozempic is not specifically labeled as a weight loss drug, studies sponsored by Novo Nordisk, the company that makes Ozempic, suggest people who take semaglutide, the active compound in Ozempic, may lose weight. 1-2. In fact, the FDA approved semaglutide for weight loss in 2021 under the brand name Wegovy. However, Wegovy provides a higher dose of semaglutide than Ozempic, 2.4 mg of semaglutide in Wegovy compared with 0.5 mg, 1 mg or 2 mg of semaglutide in Ozempic. As a GLP-1 receptor agonist, semaglutide enhances the effects of the naturally occurring hormone GLP-1. Dr. McGowan explains that in addition to its effects on blood glucose and diabetes, GLP-1 also impacts weight via two key mechanisms. Affects the hunger centers in the brain, specifically, in the hypothalamus, reducing hunger, appetite, and cravings. Slows the rate of stomach emptying, effectively prolonging fullness and satiety after meals. The net result is decreased hunger, prolonged fullness and ultimately weight loss, adds Dr. McGowan. Is Ozempic safe? Ozempic is a safe medication with a variety of benefits, notes Fatima Cody Stanford, MD, an obesity medicine physician scientist at Massachusetts General Hospital, associate professor of medicine and pediatrics at Harvard Medical School Unit and advisory board member at SWEECH. Approximately 80% of patients with type 2 diabetes also have concurrent obesity. So, these patients garner dual benefit for the treatment of their diabetes and obesity. Ozempic has also been shown to reduce major adverse coronary events, including heart attacks and strokes, and offers a host of other benefits, adds Dr. Cody Stanford. However, Ozempic isn't safe for everyone. According to the company, people with the following conditions should avoid using Ozempic. Pancreatitis. Type 1 diabetes. Under 18 years of age. Pregnant or breastfeeding. Diabetic retinopathy. Problems with the pancreas or kidneys. Family history of medullary thyroid carcinoma, MTC. Multiple endocrine neoplasia syndrome type 2, MEN2, an endocrine system condition. As with any prescription medication, it's important to consult your doctor or other qualified healthcare provider on whether this medication is safe for you, and what dosage is appropriate. Common side effects of Ozempic. Since Ozempic slows down gastric emptying, there may be a feeling of early satiety or fullness, adds Dr. Alexander, who recommends individuals eat slowly to help improve these and other gastrointestinal side effects of Ozempic. These side effects are usually short-term and improve a few days to a few weeks after starting Ozempic or changing the dose, she adds. Taking Ozempic may cause other less common, but more serious, side effects, according to the company. These include pancreatitis, inflammation of the pancreas, vision changes, hypoglycemia, low blood sugar, kidney problems, allergic reactions, gallbladder problems, thyroid tumors or cancer. Should I use Ozempic to lose weight? Using Ozempic for short-term, cosmetic weight loss is not something Dr. McGowan recommends. While this has received significant attention in the media, Ozempic and related GLP-1 medications are not designed to be used in this way, can lead to potential adverse events, and ultimately the weight that is lost will be regained. Further, this off-label use of Ozempic is greatly impacting availability of the medication for those who need it most. Individuals with type 2 diabetes, or in the case of Wegovy, individuals with obesity, he explains. Additionally, anyone with contraindications like a history of medullary thyroid cancer, multiple endocrine neoplasia, or a history of pancreatitis should not use Ozempic, adds Dr. Cody Stanford.